दादा तुझं डोकं आहे
दादा हाइट रेंज लेंगे हाँ हाँ हाँ
सेम रोल है इधर पण गेलं काय
add one or two things.
Yes.
Yeah.
Recording.
Hi, good afternoon. So, Parkinson's disease is a progressive nervous system disorder which affects the movement and balance. It's the second most common neurodegenerative disorder after Alzheimer's disease. It affects on an average 1% of the population beyond 65 years of age. There has been a significant increase in the incidence of patients with Parkinsonism. Traditionally, the treatment which was offered till now in India was basically medicines. This is a new revolutionary treatment which is going to be launched in India for the first time today at the auspices of Nanavati Hospital, along with King's College of London and Britannia Industries, which have manufactured this product. Would you like to add something?
Yeah. Say something about the medicine as a
Maybe
They can hear.
we need to show that video later to the press.
we will show it down.
So,
Down again.
my name is Professor Ray Chowdhury. I'm representing the King's College faculty with Robert Wood from Britannia and Vinod Mehta, and with Professor Patankar from Nanavati. We're very pleased to be here. I think I'd just like to point out one other thing, that Parkinson's numbers are set to double by the year 2030, which means in India alone, the number of Parkinson patients will double, and 1 in 50 of us who live beyond the age of 80 will develop this disease. So it's going to be a lot more commoner, not just in old people, but in young people. 10% of Parkinson's patients we see are below the age of 40. And these people will live with the condition for the rest of their lives. Parkinson's doesn't kill you. You live till you die, but with the condition, like diabetes, like high blood pressure. So it has massive costs, and it is estimated in another 10 years' time, it will become the most expensive neurological disorder in the world, even higher than the cost of people with epilepsy, people with dementia, people with stroke. So that's the implication. And what we are proposing is a new treatment. It's new to India. We've been working on it since the 90s, which has been spearheaded by the work from Britannia Pharmaceuticals. Very happy Robert and colleagues are here with us. And this treatment gives these patients another hope and opportunity to have treatment when the oral treatments that we traditionally use are not working. At this moment, when that happens in people in India, you give oral tablets, after a while they stop working. Either people are told, sorry, we can't do anything anymore, or they have to go for a brain surgery, which carries a very high risk of problems with surgery. This treatment gives the bridge. It bridges when the oral treatment stops working, or you have to go into brain surgery, and it's effective for people across all ages. whereas surgery can only go on up to ages of 65 or 70 max. So those are the novel aspects of this treatment, and it's very important to recognize this. And the treatment is very similar to how people take insulin for diabetes. It's injection treatment, no different to the many diabetic patients in this country who take insulin. Very similar.
And maybe you could add the response to the treatment. Within
Yeah.
7
And and we will show this in videos and so on, is the response to this treatment is quite dramatic. In our own experience, and I've treated over at least 200 people with apomorphine in my career so far, we have seen people who are housebound, not able to mobilize, needing their carer for every activity within the house, outside the house, being able to return to work. And I have a video of a very famous musician whose life was made into a film by BBC, who was able to perform a concert after she went on this treatment. And before that, she was housebound. So the impact of it, not just on the patient, but also on the carer, is really, really immense. And I think that's another really great advantage of this treatment, for which you do not have to go through all the extents of doing surgery, but you get the benefits that you get with surgery as well, the similar benefit. You see, I think that's important to recognize, that it has a really immense impact on patients, particularly those with younger, those still want to work, or those still want to be active, and so on.
Yeah, and I would like to add, it has an immense social and financial burden on the patient and the patient caregiver, the family. And this treatment would radically change the way it will go further.
Would you like to add a few words, Robert?
Yeah, sure. My name's Robert Wood. I'm the Managing Director of Britannia Pharmaceuticals. Britannia Pharmaceuticals has been in the Parkinson space since the middle of the 1980s. We've been at the forefront of the development of apomorphine for Parkinson's disease, and I'm delighted to have been invited here by Nanavati Hospital to start the program of bringing this essential medicine to deserving Indian patients. And there will be a very large population of patients who can benefit from this therapy, which is a standard of care in many European, US, Japanese, and even other Southeast Asian countries like Thailand, Malaysia, where this product is already used. So I think it's a really exciting opportunity for the company, but also, most importantly, exciting for the patients to have access to this therapy, which really does change lives once the oral therapies are no longer working as well as they should be. This therapy is really the first line in what we call device-aided therapies, and we're going to be working extremely hard to move this from a compassionate use program through to a full registration in the course of next year.
I'm happy to add that Nanavati is getting associated with King's College, which is a very important milestone that we are doing. Plus, this is the first time in India that is happening. So we're happy to help our patients. We have huge number of patients. The benefit we have seen on one patient is tremendous, and we are very positive about this association, and we want to take it forward in terms of using it for our stroke imaging, other neurological conditions, studying the data of patients. So I was speaking to the delegation yesterday, and they were happy to associate with us to take this further to the next level. So it will benefit, this association will benefit to a great extent in understanding that this is better and curing it. We give big numbers which can make the research faster. The milestones will be reached faster. Yes.
Yes, first time in India. It's a non-oral treatment.
So instead of tablets, we are giving injections like insulin. So the duration effect of that insulin is longer compared to a tablet. Initially the effect is 6-7 hours, then it goes down to 1.5 hours. So that window can be taken care of by injecting this slowly over a long period of time. So duration of symptom free time for the patient, otherwise they get frozen, they become very stiff. So the stiffness reduces, mobility improves, and for longer period.
She's asking that clinical trials have been conducted in India.
So that is, sorry, go ahead please.
So clinical trials of this drug, again, you will see this. There's data available across the world. And in fact, we have done a lot of studies in England, London, with Indian patients. So if you're asking about ethnicity, yes, the data is available. Specifically now, this will be used for the first time in India, so we're going to collect data as well, registry, post-marketing, but it's licensed, which means you have full level 1 evidence for its use now.
We can use it in India straight away.
I would pass on the cost question to Robert, but one thing I would like to say is that at this moment in time,
Thank you.
Thank you very much. Very nice, thank you. Thanks for your help.
Thank you. We will
Paresh Rawal. मैं उसी को कवर कर रहा हूँ इस पे बहुत कम है
या साइडला जा नाही जाऊ दे ना
Good afternoon to all of you. It's my privilege to welcome Honorable Cabinet Minister for Public Health and Family Welfare, Dr. Deepak Sawant sir. He has honored us by giving us time from his extremely busy schedule. Sir, we are truly grateful and truly indebted to you for your presence to grace this event as our chief guest. Honorable Sri Paresh Rawal, Member of Parliament and a very distinguished popular Indian film actor, for gracing our function as a guest of honor. Thank you, sir. Professor K. Ray Chaudhary, a well-known world authority, Professor of Movement Disorders, Clinical Director, National Parkinson Foundation, Centre of Excellence, King's College, London. Dr. Vinod Mehta, Consultant Interventional Neurologist and Movement Disorder Specialist from King's College, London. Chief Flag Bearer for leading to coordinate this event in association with Nanavati. Mr. Robert Wood, Managing
Professor Kalyan Bhattacharya ji, Professor Ray Chaudhary ji, Dr. Vinod Mehta, Mr. Robert Wood, Dr. Neeta Shah, Dr. Ali Rani. Come on, let's hear loud. Let Almighty give us all the strength, all the vigor for the excellence in patient care. Can we continue clapping, please? That's a traditional way of a country to start any good innovative program. I request all the dignitaries to be seated, please, after the land writing and the photo opportunity.
Yes, sir. Thank you, sir.
Thank you. I would request the dignitaries to be please seated. So then it's an honor to have our Honorable Health Minister and Public Health, Maharashtra, Dr. Deepak Sawantji. Himself is a medical professional and we all have witnessed the enormous efforts taken for the healthcare sector in this state. Sir is the Minister of Health and Family Welfare Government of Maharashtra. Started a compassionate medical practice in 1980 after his medical graduation. Dr. Deepak has completed his thesis on management of government hospitals in view of JJ Group of Hospital, leading to his PhD also. Dr. Sawant has served as chairman of Meltron from 1996 to 2000, elected to the Maharashtra Legislative Council from Mumbai graduate constituency in 2000 for the first time, and since then serving this third term till date. Successfully raised issues related to health, malnutrition, female infanticide, medical education, primary and secondary education, infectious disease control. Dr. Deepak Sawant has sworn in as Cabinet Minister on 5th December 2015 and was given charge of the Ministry of Health and Family Welfare. Sir has enormous awards and accolades. Just to mention few, he has been awarded as the Best Parliamentarian Award received at the hands of Honorable President of India, Srimati Pratibha Patil. Sir's name appears in Guinness Book of Records for the largest blood donation drive. Honored with Adivasi Sevak Award for his untiring efforts in improving the public health care and working on malnutrition amongst children in tribal areas of the state. I think we all have worked with Sir in Palghar area, Melghat. I mean, almost every week used to be with Sir working for the underprivileged children and the malnourished children in all the tribal areas of Maharashtra. Jans International has felicitated him 7 times for working in the areas of helping differently able, creating awareness in youth of harms of substance abuse, conducting medical camps for needy, relief and rehabilitation of flood hit in the years 1983, 85, 86, 91, 93, 97, 98, almost more than 2 decades. Dr. Deepak Sawant for his relief and rehabilitation efforts during the Latur earthquake, Sir was facilitated in the presence of Mother Teresa. I mean, he is a graduate, medical graduate. We are fortunate enough to trouble him for all our problems, and I think Nanavati Hospital is blessed with Dr. Deepak Sawant today. And without taking much of our time, I would request a small memento presentation from Nanavati Super Specialty Hospital. I would request a small memento to be given to Dr. Deepak Sawant by the hands of Dr. Rajendra Pachankar. and there is no words required for introduction of Shri Paresh Rawal ji. Can we hear loud? So guest of honor today, Shri Paresh Rawal ji, Dilit, is a veteran Bollywood actor, everyone knows, and honorable member of Lok Sabha of the Indian Parliament from Ahmedabad East. So yes, want us not to give a huge introduction, but still, sir, let me take the privilege of announcing, or let us all know that sir has been honored Padma Shri in 2014 by the Government of India for his contributions to the entertainment industry. In 1994, Shri Paresh Rawal ji has received National Award for Best Supporting Actor, Best National Award for National Integration for Sardar movie. Really, we have seen the movie so many times and it's really enlightening. 2002, so has won Filmfare Award for the Best Performance in a Comic Role for